Well, today we've got one of our health heroes, Dr. Orlando Rojas. He's not only a health hero, but a friend. And I appreciate you and I value you. And I thank God for you because you're a light and your essence is of much truth. And you've shown me and taught me so much already. And as my community knows, that the word doctor comes from the Latin docere, which means to teach. You're a teacher. And so welcome to the Made to Thrive show. And we're putting a whole dental program together, interviewing different people all over the world, and you're the light and you carry the torch and the banner in South Africa and Africa. So welcome to the Made to Thrive show.
Thank you very much. It's a pleasure to be here, and I hope I can contribute anything to your mission.
Absolutely. My mission is to inspire and empower people to live a life of thriving, and so we're going to declare the truth as best as we can and to keep learning and keep growing and keep helping each other along the journey of life. So I do want to start with a little bit of your backstory in terms of biological dentistry, how you started in biological dentistry, where you're from, where you studied, and just a little bit of an intro for the viewers and the listeners.
Sure. I am originally from Colombia, where I studied my basic dental degree, and simply because of cosmetics, I wasn't happy with my metal fillings in the mouth. So I went to my sister, the dentist, and I said, please, just replace all these things for white fillings. No way. The white fillings are rubbish. The best is this proper mercury filling. And I even had already some gold in my mouth. But it was just terrible. I was actually embarrassed now in the dental faculty by having so many metal fillings. So she said, okay, I'll replace the smaller ones, but I'm not removing the gold because the tooth will collapse. And so I did that without any precautions. And thank goodness I didn't get any sick. Then later in my life, in order to qualify, you need to write a thesis. And I chose the subject of the use of white fillings on posterior teeth. So this is now 1984 to 85 maybe, and there was nothing on white fillings on posterior teeth. Everything was always metal.
Okay.
So I only found some articles that I have to translate very expensively from the Scandinavian countries, and they were already saying that they shouldn't use any mercury fillings on children and women during childbearing age. So as usual, the men can take the punishment. Nobody cares. So with my work, the university actually bought the equipment and implemented resins for the use in posterior teeth. So that was fantastic. Now you finish and you have to do the social service. And my best friend from both high school and university, he got very sick. And then he was losing his sight on the left eye. He got a cloud, an ever-growing cloud that prevented him from seeing properly into patients' mouths. And so Colombia back then was number one in ophthalmology. People from all over the world would go to the Biohacker Center for treatment of the eyes, and he went for treatment there. Injections every second day and a lot of medication. And after a short while, he was even worse because he was shaking. He was like Parkinson's patient. He was really bad. And he was eventually bored that he couldn't practice anymore in the first year of his professional life. So his beautiful mother took him to her homeopath. Now, I have to add that he was the youngest of four, and the age difference between the next one was close to 20 years, so it was the latest edition. So we always mock his mom because she was going to a witch doctor, homeopath. My God, what is that? We are starting to become doctors in Western dentistry. So this homeopath said to him, please open your mouth. And he saw a mouthful of amalgam and said, there is nothing I can do for you. So he gave him a business card of the only bioenergetic dentist in Colombia back then. And wow, what is this? So we went to see, I went with him to see this doctor, I don't remember his name. And he did the usual examination, and we literally thought the guy was cooked, because we never had anything of that sort during our training.
But this was in the 80s.
Yes, that would be already end of 86, 1987, okay? So, and he was super busy. To get an appointment with him was months, and so basically we bought the material that he was using. We took the only precaution of using rubber dam, okay? And I removed his amalgams. And sure enough, within 2 weeks, the cloud in his eye had disappeared. And another 3 or 4 weeks, and he was not shaking anymore. So this was like, wow, what happened here?
Yeah.
We were blown away. So obviously that changed our perspective in dentistry. So I don't believe in witches, but with the right broom, they do fly. Yeah, so that's what really made me look into this direction.
Great.
And non-stop.
Great.
Yes.
And now you're practicing where, and when did you come to South Africa?
Well, soon after that, in '89, the opportunity to come to South Africa became a reality. It was a long process, but eventually I came here in April 1990 with a job at a university where these thoughts about biological dentistry were not entertained. So I had to do my job, and then in '94, with the New South Africa, by the way, with a partner, we opened a clinic that was just a normal dental clinic. But obviously from the beginning, the agreement was we will never buy any equipment or materials to do mercury fillings. And he was not, but I was using rubber dam when removing previous fillings. Here I have to add, the practice was in what we call a township in South Africa. And so I was maybe the first non-African practitioner there. They call me some of them call me the Chinese doctor, and you're a Chinese doctor. So it was an instant success. And in this population group, we seldom saw previous treatment. So they all had all their teeth, most of them in very good shape, and the only ailment would be periodontal disease, because now they were exposed to rubbish diets and no education and no income to implement oral hygiene procedures or things like that. So very amazing. And there I started having a number of white patients. This is South Africa, 1994. Okay. So going all the way to the township, okay, to see me, and invariably they would have mercury fillings in all their posterior teeth. They would have no wisdom teeth, over-servicing, I would say, due to the politics of medical aids, I would imagine. Okay, this is a dangerous assumption, but but yes, that was my early observation. So with those who came with mercury fillings, so I started implementing more safety measures. Okay, implementing one at a time, and then putting together my early experience as a baby dentist with that. Okay, now I'm in private practice, so let me start implementing what I know deep in my heart to be true. And since there was no training for that as there is today, so I pretty much had to do the research myself. And also, remember that there was no internet until pretty much those years, okay?
Yeah, sure.
So, and not that we were good at using the internet, okay? But I've been very guided and blessed all of my life. So, with being very humble, very, very humble, I have to say that I have always been guided from within into what to do. And I'm very grateful that that is the case today. So I rely more on what is called today as the universe, has to tell me, than what is the hype and the latest news of the moment.
Good.
So,
Good. Now, for the viewers and the listeners, they're not really sure what biological dentistry is. They might have heard this term for the first time. They've just gone the traditional Western medical dentistry route. And so with the benefit of the internet and training, and you've got your own mentors in Europe, which is fantastic, and connecting with people all over the world. We've interviewed Dr. Dom Nischwitz, beautiful man who's declaring truth in Europe, who's doing implantology work, which is incredible. And I know you are. And then we interviewed Dr. Al Dannenberg in America, who's a periodontist, who's moving in the biological dentistry circles. But this is a new concept for many people. They've never heard of biological dentist. Then they might assume it's a holistic dentist, which also carries certain connotations. If you can, what is a biological dentist?
Well, let me start with yesterday I welcomed a new patient, okay? Lady who is pretty sick. And she said, I've been to a few dentists. I go to them because they are holistic dentists. They claim to be holistic dentists. And then I go there, and one of the proposals is you need a root canal here, and so she immediately shies away and runs away for her life. Many of our colleagues would say I am a holistic dentist because they offer services from plain cleaning to digital guided surgery and all these things. And it is a buzzword, okay, that not everybody comprehends. I have a very simple definition. Biological. Bio is life. And logical, not etymologically, but it's what makes sense.
Yeah.
Okay? And being a lover of life. So that is my basic definition. So for those who come to me, that's what I say. I care for you, and I want you to be physically fine so that you can go further beyond the physical, probably.
Brilliant. So you did some training overseas, from what I know. I think it was a Dr. Ulrich Foltz, or who are some of your mentors in Switzerland?
I had the privilege of meeting him in Rome in 2014, and he's a super welcoming individual. He's very down to earth, amazing, and he immediately invited me for shadowing in his clinic in Switzerland. And not only I've been there a couple of times for shadowing and the courses that he offers, but I also went there for my own dental treatment because there was nobody in this country who could provide that level of service. And the treatment that I have been rendering for many years, pretty much all of my professional life in private practice, definitely went to a different, higher level thanks to Dr. Foltz, yes.
Okay, great. And we'll put those links in the show notes, and also to Dr. Nischwitz and Dr. Dannenberg. But let's move on to, people might be hearing the story and saying, I've got mercury in my mouth, I've got all these amalgams, I'm not sick, or I'm starting to have some symptoms. What do people do right now? They're listening to this and they're saying, I've got mercury in my mouth. What is my next step?
Well,
what do I need to do?
The next step, the first step, don't remove them. Please don't rush. Historically, every time there is a publication in a woman's magazine, the U magazine once upon a time published an article, and then like the next day everybody was going to the nearest dentist, and that is very dangerous. Over the years, those who are in this practice of biological dentistry, we have seen so many people that just by getting one amalgam placed or one amalgam removed, they immediately develop the most horrendous symptoms. Wheelchairs are in the order of the day. Multiple sclerosis, really, really sad. Thank goodness it doesn't happen to everybody, because as we know, it is the terrain that dictates and not the agent. But it is real. It is absolutely real. So my recommendation is definitely don't just go removing your amalgams. Do your research properly. Ask the dentist, the so-called holistic dentist, biological dentist, who follows proper protocols. In South Africa, there is a good resource, the South African Association of Biological Practitioners, initiated by my good friends, Dr. Maria Theologides and Dr. Paolo Pronieri, and then they will be able to guide them as to where to go. Yes.
Great. Thank you.
Or you're welcome to come to me.
Now,
Yes.
what is the problem with mercury? I know the FDA in America, it's still still taught to put mercury in the mouth at dental school. It's still taught. It is considered as a toxin outside of the body. You need procedures to deal with the mercury outside of the body, but it's considered safe in the body, which is a crazy thought. But what is the problem with mercury amalgams?
Well, mercury is the most toxic metal on Earth. Now only outperformed by radioactive uranium and plutonium, but before that technology was available, it was mercury. But obviously for all of us, we are more exposed to mercury from different sources, and it is important to recognize that it is the vapor form that is the most toxic. Obviously the one that you ingest is also toxic. But of whatever you ingest, maximum you will absorb 10%. Of whatever you inhale in vapor form, at least 90 to 95% will be absorbed. So it is crazy. We can talk a little bit more later, but to finish answering your question, always follow the money. Always follow the money. So, to my understanding, modern dental amalgam, the patent belongs to the American Dental Association. And modern dental amalgam contains about 14 different toxic metals. Before it was like 45 metals, including arsenic and lead and all that. But mind you, most people come with old amalgams to us because you don't get rid of toxic waste. So if people got their amalgams when they were 20 or 16 and now they are my age, they can still have them. So they have lasted a lifetime. Well, not in perfect shape, that is, because there is always a lot of corrosion. They literally go like black. If the amalgam is not in an area where one can clench on it, it will be rusted. The older it's been there, the more rusted it will be. Because sadly, the vast majority of dentists do not do what we were taught at university, to polish them and leave them in good shape and with good anatomy. Maybe that is a blessing, because when you polish the amalgam, it's a disaster. But yes, so then they get very corroded. But they are still all right, because all right means that there is no pain for the patient. And if there is no pain, then the patient typically would not seek help. Without a doubt, it is a lifetime of toxicity from the moment you get the first mercury filling. And, well, we know it is neurotoxic and it doesn't belong in the human body. So even, mercury-based thermometers, they were banned in the first world a long time ago. I remember, over 15 years ago, I went to a meeting of the South African Dental Association in my branch, and one of the big companies was giving for free as many thermometers as you would want. You could have one, you could have 15, 20, just on your way to the meeting. Why? Because in Europe and the United States, they were already outlawed. They dumped them in Africa, of course. And, oh, look, we are so generous. Here you have it.
Okay.
So not even in a thermometer they are allowed. And yes, well, I haven't honestly seen the packaging of a modern amalgam. But back in the day, and I'm sure it's the same still, big warnings, with the bones crossed and radioactive, dangerous material handled with care. And I don't know if you ever had that opportunity, but back in the day, we would even play with the mercury. So stay away from it.
Stay away from it. It's a toxin. If you go to Google Scholar, you'll find out so many research articles. I mean, this is not just pie in the sky stuff. This is research. This is proven. This has been shown to be a toxin. And also we've discussed many times on the podcast, and we'll put links to it, about having metal in the body with all these non-native electromagnetic fields, all this radiation. Holding your cell phone to the side of your head can increase the temperature of a mercury filling and a titanium implant by up to 4 degrees. And so not only do we have the toxicity now, but we have these fields, Wi-Fi, these cell phone signals that are going to cause significant problems to people that carry metals within their bodies. So the big warning bells going along, and we're here just to take people along a journey. And I just really appreciate what you said, is just don't panic, take it easy, don't rush, find the right person, do your research. Go to possibly this biological institute. We'll put those in the show notes as well, and make the right decision, because I think people panic. They've got symptoms, they're struggling, they're suffering, they've got pain, they just want to fix it, but they don't realize it's often a journey.
Absolutely.
It's a journey, and I'm privileged to have journeyed with you as my personal biological dentist, my wife and my family, and I get quite emotional because I do believe that God has brought our paths together to be pioneers and to share this wisdom in South Africa and beyond. So thank you. I do want to move on to root canals. I was blown away by the root cause documentary on Netflix that was pulled off
by the American Dental Association.
Yeah, and it was a tough thing because there were some huge claims, and we've discussed this book by Dr. Levy. The fact of root canals and how damaging it is to keep dead tissue within the body, and its impact, and some stats that I'm still looking to verify, but shocked me. 97% of women who've had breast cancer have a root canal on the same side, and so these are huge. And these are huge statements to make, and obviously there's a link and a lot more sort of unpacking and research to be done, but it's becoming more well known and more recognized across the world as biological dentists form a community. But tell me about root canals. What is the problem with a root canal?
Well, I always say to my patients in consultation, please give me an example where something that has no life anymore that we keep. Okay? So when somebody dies, we bury them, or they get cremated. The other example, and they get cremated. The exception would be the mummification in Egypt or Peru. Mummies around the world. Okay, they keep them, and if you have ever seen a mummy, they are utterly disgusting. Okay, so you see in the Cairo Museum or the London Museum, oh, how lovely, 3,500 years old, but they are incredibly disgusting.
Yeah.
So, or you look at here, dry meat. Dry meat doesn't look pretty, like the famous biltong here. Another example would be trophies for the great white hunters. So you have a beautiful animal expressing itself in nature. Out of the blue, the poor fellow gets murdered, and then they display the head on a wall. And when you look at that animal, it's so sad. It's absolutely lifeless. Okay, so 2 examples, mummies and trophies. What else? Once upon a time, romantic gentleman would give the flower to the lady, and the lady would keep the petals of that rose maybe inside a book, or some people even decorated homes with dead petals of roses. It's gone. It's not fashionable anymore because of the energy flow in the home or in the environment where these dead petals are. The next example would be a dead tooth in somebody's mouth, as if this mouth is a museum or a cemetery. So this dead tissue releases the most toxic toxin known to man, maybe after botulinum. But yes, our profession, once upon a time, heralded root canals as the way of saving teeth. You no longer have to remove your teeth, now you can keep them. And that was good news, because nobody wants to lose their teeth. But when you don't know the price that you pay for keeping a dead tooth, then it is very sad. And there is no need to talk about the 100-year-old research that everybody always talks about. But from the very beginning, it was demonstrated that root canal treatments were not good for health. Yes, science has progressed immensely, technology has progressed immensely. In my personal journey, in an attempt of keeping people's teeth in their mouths, I invested in the best technology money could buy until I gave up. And that included modern nickel titanium rotary files to clean the canals better, and going away from the usual fillers that were just solid and you would pack them one next to the other, going into you soften it with heat, so then you melt this material and it fills more of the canal than the previous system. We introduce lasers in the clinic. Fantastic. So now, instead of using toilet cleaner like Jig that could go up to 2 microns into the tubules of the root, now with laser you could go 200 microns. Okay, but 200 microns still very small. And today there are even better techniques and better lasers to clean the canals properly. There are different materials to fill the canal without like barium. In order for us to see the filler in the root, they need to put a metal. So, and barium is also a nasty heavy metal that it doesn't go well with people's health. But having said all this, technology is way advanced. They can clean the canals better, but that will not change the fact that the tooth is dead. So I would never, ever impose my opinions on any patient. They are free to follow the treatment that they choose. And when they say, there is no way I'm losing a tooth, there is no way I'm pulling the tooth out, I refer them. And when somebody goes to a specialist to do what is supposed to be a proper root canal treatment, number one, costs an absolute fortune, almost comparable to the implant option. But I have pulled out so many of those teeth. Because I'm not in this game in the last 3 years or 5 years or 10 years. So then they go and spend that extra money, But really, like you see them on the X-ray, and this is, wow, this guy is really good, because there are some amazing guys. And in South Africa, every day there are more incredible practitioners doing the most amazing root canal treatments. But I have extracted teeth that have been root canal treated to perfection for different reasons. Call it a normal dental treatment failure. Okay, the patient gets an abscess and all these things and losing bone, we have to lose the tooth, or because the patient feels that they are not the same ever since this happened. More and more people, thank goodness, are being more aware of their bodies, and they can read more what is happening within. Some others not. Okay, but when symptoms are drastic, then everybody notices. A lot of people notice subtle changes, like I'm sure you have experienced in your practice. Ever since I stopped this or I started that, I feel more energy. But the patients that normally come to me are very sick, are very sick. And we do the usual things that we do in biological dentistry. So my simple explanation is, my job is to remove infections, whatever they are. And they can range from simple gingivitis, mild inflammation of the gum that is easily reversed if one cleans, to advanced gum disease, periodontal disease, definitely infection coming from root canals, because almost invariably there is. Now with having CBCT scans more readily available, when we look at these teeth, you will always find pockets of infection. Yes, depending on when the examination is done, you can argue, or my profession could argue, oh, there was a big infection and only this little infection is left, which I accept, because indeed with root canals, the size of infection reduces and the idea is that they will disappear. But now with this CBCT technology, we can diagnose better what is happening on every tooth and what is happening in the bone.
Great.
Root canals is also one of the causative factors of cavitational osteonecrosis. Even an injection could cause the bone to die, because the injections that we normally use contain vasoconstrictors, okay? And when the blood supply stops, then you can get ischemic, absence of blood flow into the area, and the bone can die. This death of bone occurs of any size and anywhere. Many of them are so small that you cannot possibly see them due to the anatomy of the bone. So the trabecula, the pattern of the bone, well, you see the 50 shadows of gray, the 50 shades of gray. But then once they start getting bigger, then you start being concerned. Where are they? Where in the mouth? These lesions are more common towards the back of your jaw. The most common cause being extraction sites. Because also at university, not back in the day, not today, dental students are taught to remove the periodontal ligament. And because we're not taught that, then the average dentist will say, oh, nonsense, that is, don't worry about it. And many patients go to the dentist and say, but please make sure you remove the ligament. Whatever, yeah. It's done. Did you remove the ligament? Yeah, of course I did. So how does this happen? If you think about the anatomy of the body, where do we find ligament? Where is it?
Bone to bone, yeah.
Joining structures, okay? Joining the muscle to the joint to the bone, holding organs, holding the tooth to the bone. Now, when the tooth is taken out, that ligament doesn't have a job. It's unemployed. And unemployment causes trouble. Sorry. Then in a very good day for the patient, most of these ligament fibers come attached to the roots, and only a few remain. In a bad day for the patient, most of the fibers remain attached to the bone, and they decompose. So the initial healing, the gum closes, if the dentist did not close the wound, and then the bone starts repairing itself, if it repairs itself. So pain is one of the greatest gifts for health.
That's right.
Because when there is no pain, like most of the silent cancers, when they give pain,
you're in trouble.
Right, you're in big trouble. You're in big trouble. So if there is pain after the extraction, then the patient will go back to the dentist. Sadly, most dentists would say, oh, just take more antibiotic or take antibiotic. Or they will do the right thing, which is open the wound, scrape properly, cause bleeding, and in that scraping, they are removing not only the necrotic tissue, but also ligament fibers, and bleeding is healing. So then the wound has a new opportunity of healing. But if there is no pain, then that is what will lead to these systemic problems. Because then you will, if the bone has not healed in 6 months, it's never going to heal. As simple as that. And then it's necrotic. It's just chronic infection that would challenge the immune system, and that would indirectly be causing other conditions. So
let me summarize, Doc, because there's a lot there, and I think it's important that people sort of just hear the summary, and you can just correct me with regards to what you said. Number one, there's no place for a root canal. You're leaving dead tissue in the body that might get triggered years later to cause some serious toxic effects in the body. And it might be a very small infection, but it can lead to things changing in years to come. Is that correct?
Yes, absolutely.
Great. Second, we can get a process called cavitation when we remove teeth. If the procedure isn't done correctly, or osteonecrosis of the bone, and we start getting this cavitation, this osteonecrosis, and this dead tissue of the bone can have systemic effects.
Absolutely.
Great. So if people have removed their wisdoms or they've removed a tooth, what should they do?
Yes, opening the can of worms, the Pandora boxes, going down the rabbit hole. Almost, and this is a very daring statement, okay? But almost everybody who has had a wisdom tooth removed would have osteonecrosis, and of different sizes and severities, but most of us, including myself, would have them. And yes, they need to be clean. So just consider this for a moment. If anywhere else in your body there is necrotic tissue, do you leave it?
No, you don't. No, you don't.
You don't. Any good surgeon would remove whatever needs to be removed. And if for things of life during surgery they see, due to this incision, maybe this tissue will not have proper blood supply. If I close, this tissue might die. If they notice it, they will cut it away, because it's easier in that moment than having to open the patient again. So why would we leave that tissue in the mouth? It's like extractions, a normal, simple dental extraction. What were we taught? We do the things that we have to do to remove the tooth. And once the tooth is out, typically and historically, bite this gauze or cotton, and off you go. So would you ever leave a clinic if part of your bone is showing anywhere in your body? No way. No way. If it is a terrible open wound, until it is properly fixed, you don't leave the hospital. But now, every single day, gazillions of people go to the dentist somewhere to have a tooth taken out. Before you leave the dentist's office, the bone is soaked in saliva. Now, saliva is either good or is not good. So in nature, we see our beautiful animals licking their wounds and the wounds heal. But we are a particular kind of animal. So our saliva is not necessarily a good saliva for healing because of other issues. So by definition, that bone is already infected. So then you get home, you are thirsty, you are hungry, and very soon you will have organic broccoli in contact with your bone or anything, tea, coffee, soup, you just name it. That doesn't make sense. And yes, that's what we learned and that's what we did for many years, but it doesn't make sense. So it is very important to cover this wound after scraping the socket properly to prevent infections. And again, osteonecrosis could happen due to many different reasons, not only extractions. As I mentioned, a simple injection can cause it. Undue movements of the teeth could potentially cause it. The absence of teeth. A lot of people, due to genetics, would not develop a tooth. But in the process of differentiation of the cells, in the very beginning, when the little cell says, oh, I want to become a kidney and I want to become a tooth, so those cells that get together to become a tooth, we call it the tooth germ, the process can stop at any moment. And there is no tooth. So I was so lucky, I didn't get wisdom teeth. Some people are less lucky and they don't get incisors or certain molars. So if there was indeed a tooth germ developing and it stops growing because it dies, now it is dead inside your body. So if we were always, from the beginning, healthy individuals with the right biochemical balance, the immune system will take care of absolutely everything.
That's right.
The remnants of that ligament, the remnants of the tooth germ, of everything. But in modern society, that is sadly not the case, because the average individual from day one would be giving their babies the wrong foods. And then we also want to eat the wrong foods, and all of us, even you, we go and indulge in the wrong nutrients. So then the body loses the ability of dealing with these challenges, and then they develop in trouble. So how come you are telling me I have a cavitation if I never had wisdom teeth? Well, I have treated so many cases with people with all their teeth in their mouths, including the wisdom teeth in perfect condition, with cavitations behind the wisdom teeth. Well, definitely, you shouldn't even have a tooth. On occasion there are, but those are the exceptions. So cavitations can happen anywhere. There is another aspect. The lower jaw is considered to be the dumping ground of toxic waste. Toxic waste being all the preservatives that we have had, all the heavy metals that we have ingested from canned food and processed meats and all these things. Pesticides, you just name it. Everything that comes our way in this modern world. So they have affinity for the lower jaw. So there are many, many reasons. So with a CBCT scan,
just what is CBC? Is it cone beam?
Computerized tomography.
Okay, there we go.
So that gives us an image, and then you can show, oh look, you see, this is good bone in your mouth, and immediately next to it, it is different. Why is it different? Because it is hollow. Why is it hollow? It should be bone. Okay. So it is a good tool to recognize it. Obviously, historically we had the cavitat, and my beautiful mentor in South Africa, Dr. Pete Boshoff, he bought many years a cavitat, and then he thought he was going to retire 10 or so years ago. Said, hey, I want to get your cavitat. But he couldn't retire because he was cleaning cavitation. He was on a campaign, you know, he lectured extensively on cavitations in this country, just to be the laughing stock of his peers. But we are used to that, and I really don't mind. So eventually he just said to me that there are too many false positives with the cavitat, and there is a new device, I've read about it, I forgot, Dr. Lechner, who is the world authority in cavitation. He has developed an ultrasound device, a very expensive device for the African situation.
Sure.
That also promises to be a good diagnostic tool, but there are other not conventional ways of determining the presence of necrotic bone.
Okay, fantastic. So we've looked at amalgams, we've looked at root canals, cavitations. Now, I do want to discuss your own dental protocol because I think that's important. There's so much debate, and as I'm getting down this rabbit hole, there's people that want to brush with activated charcoal and bentonite clay, and other people are saying now you just need water. You know, there's no need for toothpaste. There's this whole view on using essential oils in toothpaste and keeping it as natural as possible. Then the whole point of flossing, that flossing's good, flossing's bad, flossing causing bleeding gums, the correct way to floss. Then to use these little picks, these gentle picks, to be gentle with your teeth as possible. So I know there's a lot of discussion there, and I think people have their own different sort of understanding. But tell us about your dental process, your own dental hygiene.
Thank you for putting me in the spot. Well, that was also a loaded question. What I do, I have breakfast, and then I brush. And I brush with a very good brush, the one that I recommended to you, a sonic brush. And I do it for, depending on the time available, 4 to 6 minutes. And I conscientiously and with full awareness, I make absolutely sure that I have brushed every single surface of every single tooth as far it will reach. And then in the evenings, after dinner, since I don't go for snacks at midnight like my children, so I brush my teeth and I floss my teeth. I don't use mouthwash. I have rarely, like you have a bottle of this super fancy organic mouthwash that a patient gives you or that you get, and then you use it until it is finished. And normally I am the one who finishes them because typically the taste is not the best. So that is my routine.
Yeah.
That is my routine. And so twice a day and flossing. So you also have the debate, what do you do first? Did you floss first? Did you brush? So if you floss without brushing, there is so much debris coming out. It's crazy. So I prefer to brush first, okay? And then when I floss, I only remove the plaque that the brush didn't reach. That is my take. Now, all the controversies in our world. In the vast majority of the world, there is no controversy. You go to the supermarket, you pick up the cheapest toothpaste, and that's it. So we have to bear in mind that all toothpaste, commercially available toothpaste, most of it, is antibacterial. So, as you know, it kills the good, the bad, and the ugly. But what the vast majority of people do not know is that the vast majority of bacteria in the mouth is good.
That's right.
98% is good bacteria that we need. So, the cycle. with babies. In the beginning, they would just go into the mud, play with the cat, the donkey, and the horse and the cow, and they were healthy peasants. Beautiful, as God intended it to be. Okay? And then, oh, it's dirty. And then there was the wave of obsession that everything needed to be clean, and for babies, everything needed to be sterilized. Great damage for the immune system of this growing child. So same with the mouth. The body is not designed to be sterile because we don't live and function in a sterile environment. So the best toothpaste, this is an ad. It's an amazing toothpaste that I use from the United States, invented by a biological dentist, Jerry Curatola, in New York. Reviting, expensive and beautiful toothpaste. Why? Because it is purely a prebiotic toothpaste with a bunch of vitamins C, D3, K2, E, and ionic minerals. So it pulls the plaque from your teeth towards the toothpaste. And then when you're done, I rinse with it, and then I swallow it. Because it is an expensive toothpaste, it will benefit my entire health. Yes.
Great, thank you for that.
And the flossing.
Yes.
The flossing. Life, actually, as a whole, is about being free and breaking free, so that you can evolve. So, and breaking patterns, conditioning, programming. I grew up without floss because if there was floss, nobody used it. Okay. Then my sister, the dentist, oh look, this actually exists. So whatever. Then at university, my God, if I don't floss, my teeth are going to end up like the cases that we are seeing in oral pathology and in clinical practice. So it became my routine due to conditioning. Flossing does not cause you to bleed. That is not true. Gums bleed when they are sick. And if the gum is sick and you touch it with a floss, it will bleed because it is already inflamed. And you know that inflammation leads to bleeding. But how far do you floss into the gum? What are you supposed to do? So if we had the discipline of following the advice of great experts like Dr. Dominic, if we were that disciplined, so we wouldn't have problems. And indeed, if there is a biochemical balance, you don't even have to brush, unless your partner forces you to brush because of breath coming from the gut, not from the mouth. So that is the truth. So the human being was not designed to brush his teeth. But then that human being had the right diet and the right lifestyle. But now the rules of the game have changed. So we cannot expect the average person who comes to your office to follow all the advice that you give them. And then in my profession, it's even more challenging. Because nobody likes that. Like, flossing is, they barely brush, never mind flossing. And then you also see typical couple, the lady is obsessed with health. She buys all the supplements that she can get hold of, okay? She brushes 5 times a day and flosses as many times. And the husband doesn't give 2 hoots about it. He hardly brushes. And then the lady is the one full of cavities and problems, and the guy only clenches his teeth. So because there are more things beyond the physical body.
That's right.
And it is very important to have the full and honest realization that we are not a sack of bones and flesh. Hence, I'm not obsessed for the body. The body is an amazing and the most important vehicle for us to express ourselves in this reality.
That's right.
So that's why it deserves the respect and the care so that it will take us through our life. But I have to tell you something. Everybody has always used that vehicle until their death.
Yeah.
So, in whatever way. So, once you transcend, and again, this is next level, the obsession, the paranoia. Oh, but what is this? What am I eating? What am I applying on my skin? What is this going to do to me? And you free yourself from that, you will be healthier.
Yeah.
And if your path is supposed to take you through ill health, and I don't wish this to anyone, what about your psyche? Where do you feel in a better space? Following a gazillion of rules and methods to be healthier and younger, and oh my God, then you're overwhelmed.
Yeah.
And you don't have an instant of the day to breathe. To breathe with awareness, that is. So, in my personal experience, I have gone through all of that. The roller coaster of emotions, the obsession about a topic or 2 or 3 or 10. And of course, the most important one is the liberation from it. And once you free your mind from fear,
Yeah, that's right.
especially now, please.
Yeah.
Once you free your mind from fear, nothing really can touch you. Nothing really can touch you. And you appreciate the beauty of what is important.
Fantastic. So that's Dr. Orlando's dental program. And,
Sorry, that's not a
process.
program.
That's what he does on a daily basis. And I do think consistency is important more than intensity. You know, it's no point brushing your teeth for 10 hours in one day and then leaving your teeth for 3 months. We want to be consistent with this program, this daily dental program. Also, I think what's very, very important is understanding that this physical body is often just the manifestation of where we are.
Absolutely.
Spiritually, emotionally, and mentally. And to realize those out there, one of the pillars of Made to Thrive is purpose. Each and every single person listening to this or watching this has a unique purpose, a purpose to bring to this world. And if you value that purpose and delight in that purpose, then you are going to cherish this body. And amongst the angst and the anxiety and the panic that's happening in this current situation, people are now trying to put in all these healthy sort of processes and programs in place, but they've neglected their bodies for 10, 15, 20 years. And unfortunately, they are now reaping what they've sown for many years. And to change that ship is a difficult one, but you can start straight away today. And the last question as we come to a close on the Made to Thrive show is, if someone is listening to this, what can they do? What 2 or 3 practical things can they do to improve their oral health?
Sugar.
Sure.
Can you look at your audience in their eyes and say, I never, ever take a bit of sugar?
No.
Go ahead.
Don't we love Dr. Orlando?
I cannot do that.
Yeah.
I cannot do
No,
that.
of course
Why?
we can't. No.
Because I enjoy a proper, beautiful chocolate, not a garbage chocolate. I will not have cake on my children's birthday.
Yeah.
I cannot present them with a broccoli pie for their birthday. Life carries on.
No, sure.
It is very sad that most people will only consider the possibility of having vegetables when they have cancer.
Yeah.
It is very sad because it is also very late. Okay? So it's common sense. It's common sense. And while it is true that most people don't really know what is good for themselves, try and learn from the elderly, the experience.
Yeah.
Because they have walked their paths. And sadly, when we are young and full of energy, so we think that we are invincible, we think that we will never die, ill health will never touch us, and we abuse our bodies. And that is basically part of the main reasons of ill health, and definitely of cavities and cavitations and leading to root canals, because the nutrition of the average teenager is pathetic. It doesn't matter, It doesn't matter how well you train your children, but you have beautiful kids, your boy is amazing. So eventually they will just indulge in not having a routine. If you don't sleep well, if you don't rest, that is essential for good health. If you don't rest, then the immune system doesn't have the time to recover from the insults that they receive, that it was given during the day with the sugar here and the chocolate there and the processed foods. But so how can you make sure that the youth eats well when the best choices are not the easiest choices, and the opposite applies? Just go to any supermarket in the planet. While you are in line to pay, at the children's eye level, you have all the rubbish. Mommy, mommy, mommy. And then, as my wife would say, oh, but you wanted it. so it is very difficult.
Sure. But the road less traveled, the difficult road, is often the road of truth, of wellness and health. And unfortunately, a lot of society wants the easiest, the most convenient road. And there is a spiritual reset. There's a health reset happening now with C19 and people's immune systems being challenged. And there's a lot of suffering and pain. And we want to acknowledge those people going through that. But we also want to say, how can we learn from it? How can we grow from it? And so we'll link to biohacking your bloods. I'm looking at some markers like your HSCRP, your inflammation, how important that is, your sleep data. Tells us a lot about your lifestyle and the food you're eating. And there's some incredible sort of people eating different diets that sleep well, they're well rested, and they're not full of fear and anxiety. They have purpose and they have loved ones that they're living for, and they're flourishing. So I think sometimes we do need these audits outside of ourselves because we don't see things. We have blind spots and scotomas. And so we'll link to those, different markers that we can look at to try and help us. Because there's certain people that need to just see it. They can't believe it before they see it.
And along those lines, and also inspired by Swiss Biohealth, in my new clinic, I have a number of biohacking gadgets.
Beautiful.
So because most people are very anxious for dental treatment, especially when it comes to surgery, so we can welcome them in a massage chair. Okay?
Beautiful.
We do infrared and near infrared light therapies. We do lymphatic drainage. We have a host of lasers and beamer mats and things to facilitate and help patients to recover for surgery, after surgery. So it is absolutely essential. And some of those toys are very expensive, some of them are not. So when somebody has the will and the financial possibility of buying some of those toys, by all means they should should have them at home.
Well, it depends what you value, if you might value a Bentley or a holiday home, or you might value
a decent body.
Anyway, thank you so much, Dr. Orlando Rojas. He is just a health pioneer. He's my personal dentist. He's my go-to person when it comes to biological dentistry. He's fearless, courageous to stand up and declare the truth. And so I honor you, I salute you, I respect you, and I thank you for the journey that we walk together. I know that it's going to be many years that we're going to come alongside each other, asking questions of each other, not in a way to minimize the other person, but to sharpen iron against iron so that we can be the best people we can be, that we were created to be. And so we do it together in respect, in love. And so I appreciate you and your calling, and you are a light, and I thank you for that light.
It is my privilege to be in your life.
Great. Thank you so much.
Thank you very much.